Did you know that your body may be sending you silent signals that something is wrong with your heart? Heart disease often manifests itself in subtle ways, through your skin and nails. These signs can be ignored, but ignoring them can cost you dearly. Today, I'm going to show you some of the most important signs that can indicate serious heart problems, and that many people are unaware of. Stay with me until the end, because understanding these signs could literally save your life. Have you ever noticed that the tips of your fingers are swollen or rounded, like drumsticks? This is one of the most visible and yet most ignored signs of a heart problem. The rounded shape at the ends of your fingers, known as drumstick fingers, is the body's response to a lack of oxygen in the blood. When the heart or lungs cannot supply enough oxygen to the body, the extremities, such as the fingers, begin to change shape. This sign is most commonly associated with heart and lung diseases, such as congestive heart failure, valvular disease, and even chronic respiratory diseases. The most worrying thing is that it usually appears gradually without pain, which means that many people don't even realize that something is wrong. If you have noticed this change in your fingers or in someone close to you, it is essential to see a doctor. This is a sign that cannot be ignored, as it may indicate that something much more serious is happening in your body. Yellowish spots on the skin may seem harmless at first glance, but they can be one of the most telltale signs of serious heart problems. These small deposits of fat under the skin, known as xanthomas, usually appear in the areas around the elbows, knees, hands, or even around the eyes. Xanthomas are caused by the accumulation of cholesterol in the body, which can indicate that your cholesterol levels are extremely high. And what does this have to do with your heart? High cholesterol is one of the main risk factors for developing heart disease, such as atherosclerosis, which can lead to heart attacks and strokes. These yellowish spots are your body screaming for attention. If you have identified these signs, do not ignore them. Increased cholesterol levels may be putting your heart health at risk. See a doctor to check your cholesterol levels and take the necessary measures before it is too late. When your skin or nails begin to acquire a bluish or pale color, this can be one of the most alarming signs that your heart is not functioning as it should. Blue skin, known as cyanosis, indicates that your blood is not receiving enough oxygen, a problem often related to inadequate circulation, directly linked to serious heart disease. Cyanosis can appear on the extremities of the body, such as fingers, hands, feet, and even on the lips. This happens when the heart is unable to pump blood effectively, or when there is a blockage in the blood vessels, making it difficult to distribute oxygen. Pale skin can be a sign of reduced blood flow, which can also indicate that the heart is having difficulty maintaining adequate circulation. Both signs are red flags, especially if they appear suddenly or for no apparent reason. If you notice that your skin is turning bluish or pale, do not hesitate to seek medical help. It may be a sign that your heart needs immediate attention. Have you ever noticed vertical lines that appear on your nails? Although often associated with aging, these lines can be a warning sign of deeper problems. They indicate a disruption in blood flow, and in some cases, are related to heart disease. These lines, known as striae or onychorhexis, can appear suddenly or become more pronounced. When this happens, it's a sign that your blood isn't circulating properly, and your heart may not be pumping as hard as it needs to keep your entire body, including your extremities, healthy. Although they're not painful, these lines are a subtle reminder that something may be wrong with your circulatory system. They can also be associated with a deficiency in nutrients, such as iron or protein, which can also be linked to heart problems, especially in people with poor diets. If you've noticed these lines appearing suddenly or in large numbers, it's important to see a doctor. They could be the first sign of a cardiovascular condition that needs attention before it becomes something more serious. Small red spots or lines under your nails may go unnoticed, but they're an important signal that your body is trying to give you. These spots, called splinter hemorrhages, are caused by small blood vessels that rupture under your nail. Although they can appear due to minor trauma to the nails, they can also be indicative of something much more serious: heart infections. When these spots appear for no apparent reason, they could be a sign of endocarditis, a dangerous infection that affects the lining of the heart. Endocarditis can damage the heart valves and, if left untreated, can lead to serious complications, such as heart failure. These small red spots are easy to overlook, but they should not be underestimated. If you notice these marks on several nails without any visible trauma, seek medical attention immediately. Your heart may be crying out for help, and quick action can prevent major complications. Have you noticed your feet or hands swelling at the end of the day? This swelling, known as edema, can be more than just a passing discomfort. It is a clear sign that something is wrong with your body's circulation, and it may be directly related to heart failure. When the heart cannot pump blood properly, fluid begins to accumulate in the extremities, such as the feet, ankles, and hands. The result is persistent swelling that often causes a feeling of heaviness and difficulty putting on shoes. In addition, this fluid buildup can be an indication that the kidneys are also being affected, as they have difficulty eliminating excess water when the heart is not functioning properly. This sign is one of the most visible and uncomfortable, but many people ignore it or attribute it to heat or fatigue. If the swelling persists, especially without an apparent cause, it is important to seek medical help. This may be one of the first signs that your heart is under great stress and needs immediate attention. Have you ever noticed that some wounds on your body seem to take forever to heal? This could be more than just a skin problem. It could be a sign that your heart isn't working properly. Wounds that are slow to heal, especially in areas like your feet and legs, are a strong indication of poor circulation, and this lack of blood flow can be directly linked to heart problems. When your heart has trouble pumping blood effectively, oxygen and essential nutrients don't reach your extremities, like your lower limbs, properly. This makes the healing process slower and more difficult. What's worse, this condition could be a sign of more serious heart conditions, like heart failure or atherosclerosis, the hardening and narrowing of your arteries. These wounds shouldn't be ignored, as they're a clear warning that your body is struggling to heal. If you notice that cuts, scrapes, or other wounds are taking longer than usual to heal, it's time to see a doctor. It could be a sign that your heart health is at risk and needs urgent attention. If your skin is constantly dry and flaky, even when you use moisturizers, it could be more than just a skin problem. It could be due to poor blood circulation, which is an indication that your heart is not pumping blood efficiently to all areas of your body. Dry skin can be the result of not enough oxygen and nutrients reaching your skin cells. This condition occurs when your heart is unable to maintain adequate blood flow, leading to dehydration of the outer layers of your skin. Additionally, excessive flaking and dryness can be related to arterial diseases, such as atherosclerosis, which block blood flow and impair circulation to your extremities. While it's easy to blame external factors like the weather, dry skin can actually be a reflection of what's going on inside your body, especially your cardiovascular system. If this condition persists, even with normal care, it's essential to see a doctor to determine if there are circulatory or heart problems behind your symptoms. These signs may seem common, but when combined, they are a red flag for your heart health. If you notice any of them, don't ignore them. Seeing a doctor is essential to ensuring that your heart is functioning at its best. Prevention is always the best way to go, and your body is constantly trying to communicate with you. Pay attention to the signs and take care of your heart. Don't forget to like this video, subscribe to the channel, and turn on notifications so you don't miss more content like this. See you in the next video.